time that you speak. Roll call will be taken for every action item that we engage in today. As you heard, the meeting is being recorded for the purposes of posting the recording on our website, and also we are live streaming on the Access Health Connecticut website. And it's great to see everybody. And Marcin, if you could, please call the roll call.
Yes, Mr. Chair. Steve Hernandez, Chair.
Present.
Grant Ritter.
Here.
Thank you. Paul Philpott. Paul Lombardo. Mr. Lombardo.
Here.
Thank you. Matthew Brackman. And Kathleen Holt. Thank you, Mr. Chair. We do have a quorum.
Thank you so much. And now, if you would, could the members of the Access Health Connecticut senior leadership staff introduce themselves?
Good afternoon, James Michelle, Access Health is here.
Gina Walsh, Director of Operations, Access Health CT.
Good afternoon, Susan Rich-Bike, Director of Legal and Governmental Affairs.
Good afternoon, Holly Zwick, Director of Finance.
Good afternoon, John Carbone, Directors. Sorry, Tammy.
No, go ahead.
John Carbone, Director of Small Group Product Development, Broker Support.
Good afternoon. This is Glenn Jurgen, Director of Human Resources, Access Health CT.
Good afternoon, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Marquise Davis, Director of IT, Access Health Connecticut.
And I think that is everyone that I can see on the screen. Is that right?
I think so, Mr. Chair.
Great, thank you. And Marcin, was there any public comment for this month's meeting?
We did not receive any public comments for today's meeting, Mr.
And
Chair.
thank you for that. And let's take up our first order of business, which is approving the minutes of April 11, 2025 of the Strategy Committee meeting. Could we entertain a motion to approve the minutes?
Motion to approve. This is Grant.
Thank you. We have a motion. Is there a second?
Second, Paul Lombardo.
Thank you, Paul. Great. Is there any discussion on the minutes themselves that were circulated prior to the meeting? Any discussion? Seeing none, we will take a, if you would, take a roll call vote on the approval of the minutes, Marcin.
Yes, Mr. Chair. Steve Hernandez.
Yes.
Grant Ritter.
Abstain.
Paul Philpott. Paul Lombardo.
Yes.
Mr. Lombardo.
Yes.
Yes, okay. Matthew Brackman. And Kathleen Holt. Thank you.
That's great. Thank you, Marcin, and thank you all. I believe now the staff is going to be presenting us with strategic project updates.
All right. Good afternoon, everyone. Merchant, did we have a slide for 10 clicks? There we go. Perfect. Thank you. Good afternoon, everyone. I am Marquise Davis, Director of IT for Access Health CT. Several months ago, we set out to modernize our enrollment system to reduce processing time and our user experience for the residents of the state of Connecticut. We worked with our consultant firm Minton Hope to establish tactical block group teams to develop and identify recommendations for the reimagined enrollment system. We integrated our change management strategy process and conducted interviews with our stakeholders as a result of this initiative. Now that the tactical block teams have completed their assignments, we are in the process of creating our RFP phase. We hired an RFP writer in the process of gathering requirements for the submission of the RFP later this summer. As you can see, the dates are absent from the timeline. However, we're in the process of adjusting those dates to bring us more towards a realistic go live date. And the goal is to have those dates available for you during our next committee meeting. We're excited about all the work that we've done and completed thus far. over the last several months, and we're confident that we're going to finish strong and continue to move forward. So I have any questions?
None from me. Any questions from either the board members or any other characterization from the staff? That's great. Thank you for that update.
Thank you.
Next, we have the call center.
Good afternoon. Hi, I'm Gina Walsh. I'm the Director of Operations here at Access Health Connecticut. Today, I'll be providing an update on our call center activities. Yep, thanks, Martine. We're on the right slide. We're currently enhancing our call center's interactive voice response system, which is an IVR. It's the automated phone system that guides callers through the menu options to help them find the assistance that they need or connect to an agent. Our goal is to make the IVR more interactive and user-friendly to improve the consumer's overall experience with Access Health. Right now, our current IVR uses just keypad entry, has very limited informational messaging, and supports only English and Spanish. Our future enhancements will allow callers to speak into the IVR or use the keypad still if that's what they're comfortable with. It will also be adding additional language support. We are going to start with there's 6 top type languages that come into the call center. So we're going to be adding Portuguese, Haitian Creole, Arabic, and Ukrainian. Also, with the new enhancement, it's going to enable our IVR and our agents to send text links to consumers if they choose to receive them from our website. So an example is if a caller calls in and they don't know what they're supposed to be providing to the agent, they can ask that in the IVR and it'll ask if, they want to be texted to the number that they're calling from. Obviously, they need to be calling from a cell phone. Or when they're talking to an agent, if they need that information, it could be text right away, or if they have questions about what verification documents they need to send, they can text those things too. And we'll be building that as we go through the different phases. So very excited with the new things that will be coming. We're also improving the current callback feature, which holds a caller's place in line and automatically calls them back when it's their turn, so they can go do other things and their phone will ring and it'll be one of our agents calling them back to assist. Additionally, the IVR will automate call transfers within the system. So if they're looking for the Department of Social Services Benefit Center and they called the wrong number because they thought they were supposed to, call the enrollment number, it could transfer them over. If they're looking for an ID card or have some type of billing question about a bill they received, it could transfer them right to the carrier if they have one of the carriers. So exciting new features that are coming. The next phase of the IVR enhancements will support also auto authentication within the IVR. Next slide, Martine. So here are some key milestones that have been achieved so far. The call center IT team has built the IVR framework, so that is ready to go. Our Access Health team, we have a small project team working on this, has reviewed and approved all the IVR language, so it's ready for recording in the different languages or in English. We've also shared the finalized changes that we have with our internal teams, and we will be communicating those outward in the next few weeks. So looking ahead, Access Health will have final approval on all the IVR recordings, and then we'll be conducting end-to-end testing through the IVR to make sure everything is working the way it should be. Our planned go-live date currently is July 8th, so very excited about the transition. As Marquisa talked about our system, we also want to have the phone system be the most updated version of itself too. So that's the end of my presentation. Thank you for your time. Are there any questions?
Thank you. That's really exciting. The notion of being able to expand language access is something that we've been thinking very carefully about across the state. It was the subject of a lot of discussion this past legislative season, and I'm excited that you are leading in yet again in another space, and this time providing the best service through as much accessibility as possible. Because Access Health Connecticut is more than just about service, it's also about opportunity, prevention, and health. So appreciate these efforts very much.
Thank you.
Next, I think we have an ICRA update, unless there are any other questions. Thank you.
Good afternoon, everybody. John Carbone, Director of Small Group Product Development and Broker Support. We're very happy to announce that we will be going live 7/1 with our platform. We have integrated all our products and our modules all together for our release of 7/1. We've trained over 150 brokers at the moment and have another 250 lined up in the next 2 weeks of training for 7/1. We have also met with both of our carrier partners to train them on the platform themselves. At Connecticut, we had about 15 individuals that we trained, and with Anthem, we've had about 20 individuals that we trained that will also participate in the platform and be able to help out their members. Our brokers and our carrier partners are excited about the opportunity to be able to bring another tool and put another tool in the toolbox to be able to help members shop for plans through the platform. We're excited to bring a new step into the equation of allowing the individuals and the employers to make payments on behalf of the member. So that helps us with retention. It also helps with the members being able to see all their products and their payment system live in one platform. And for our future updates, we are going to be integrating in the next 6 to 8 months our small business platform into that product. So stay tuned on that. We're excited about that new endeavor. So if anybody has any questions, please don't hesitate. We will also send out our new brochures to the committee. I will get those over the Martian to share out to the committee. We've developed 2 to 3 new brochures that we are going to be able to share with everybody that basically explains ICRA from a broker standpoint, an employer standpoint, and an employee standpoint. So at this time, I'll take any questions if anybody has.
That's great, thank you. And just to clarify, are these brochures that will be available for the information of the brokers, or that they will be able to use for the information of the consumer and the public?
Both. So
Got it,
we've
great.
developed we've developed a one brochure that has all the information for the broker and the employer and the employee all in one. So each knows what each's responsibility is, and the other one knows who they need to reach out to. So we're trying to cut times and people calling the call center and waiting. We want them to get right to the spot they need to immediately.
That's great news. Thank you so much, John.
You're
Any
welcome, sir.
questions
Thank
on
you.
the ICRA? Thank you. On the ICRA update. Great. Seeing none, seeing no observations, I'm really excited for this next, not that I wasn't before, but I'm especially excited about the Broker Academy update. I believe it's Tammy.
Yes. Hi, good afternoon. Good afternoon,
Yeah.
everyone. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT. I have a brief but great update on the Broker Academy Year 4. Just to recap a little bit, throughout the month of May, we really focused on getting the students to complete the coursework on the Kaplan portal, Kaplan being the training provider, state-approved training provider we use for this program. So in addition to having access to books, so on the portal, they had access to study guides, quizzes. They even had access to an instructor virtually to answer any questions. In addition to all of those resources, we held weekly review classes to keep them on track as well. So the students really had a good understanding of the materials before coming into the in-person classes. Those in-person classes were held last weekend, and we successfully wrapped those up. They were in New Britain and Danbury, and they were held at our community partners site, CT Leads. They were so generous this year, letting us host our classes at the New Britain and Danbury locations, which were fantastic. We had 50 students that passed the class certification test, which is in line with the numbers in previous years as well. And so they are ready to sit for the state exam now that they've passed that class certification. So these in-person classes really served as a review session for the state exam, and it really gave the students a final push to prepare to sit for those exams. During the classes, we successfully registered 48 of those students to take the exam this month, keeping them on track for the mentorship portion of the program. And so we're excited to get into that next phase of the program beginning in July. And we've completed the RFP process for mentors. We received 11 applications. So we're going through that and we're finalizing that as well. So more to come as the students continue to take the state exam. We've already had a few students pass just this week, and most of the students need more time, so they're scheduled later in the month, but more to come. And I'll pause here for any questions.
Hey, Tammy, can you talk a little bit about the demographics? I know I visited the New Britain class on Saturday. It was
Yes.
all ladies, 2 guys, and about 25 or 26 women in the class, and just an amazing diversity.
Yes.
So good, Tammy. Give a quick
Yes.
update on demographics of the students.
I can have more specific numbers, but the demographics, as in previous years, majority female, minority females. This year, we had a majority of the females identified as Hispanic, and typically it is more African American. So yes, the New Britain class was, I think, around 65 to 70% female, and the rest were male. But in the Danbury class, and this was kind of new, and I'll get the stats for this, we had almost equal numbers of male and female in the class, which is kind of different for us in this program. But I can have a specific breakdown for you the next meeting.
This community partnership with Latinos for Educational Advocacy and Diversity, tell us more about that, because I know that they are expanding their community centers to different parts of the state, including the Hartford region. I think East
Yes.
Hartford pretty soon.
Yes, East Hartford is coming up. We have a great partnership with Maria Matos and her team. They allow us to use their space for enrollment events, and they welcome us. We do a lot of presentations with her and her team. So we've had a long-standing relationship with them in terms of events, and also they support us with allowing us to use their space. And Maria is fantastic. They have the programs in place, they have the classrooms in place, so it was a natural fit, and she was gracious enough to let us utilize the space without any cost. And her and her team supported us the entire weekend. She also came and visited the class as well. So extremely important and community partnership with LEAD, and we continue to build on them. And we try to do that with other partners as well. But LEAD had locations in the geographical locations that we were looking for, and space.
That's great. And those partnerships really do matter, because that they will contribute to you accessing more diverse populations, more diverse
Absolutely.
geographies, in addition to demographics. So kudos on that type of partnership, and continue to expand that. Thank you.
Awesome. Thank you so much.
Any other questions or reflections? Great. And let's see now. I think we have now, we're going to move to Susan Richby, I believe, on what's on the forefront of a lot of our minds, which is the impact of the One Big Beautiful Bill.
Thank you, Mr. Chair. Susan Richby, Director of Legal and Governmental Affairs at Access Health Connecticut. The federal reconciliation legislation, called One Big Beautiful Bill, as Steve mentioned, was passed by the U.S. House of Representatives on May 22nd. It is now being considered by the U.S. Senate. The bill incorporates provisions from the proposed marketplace integrity and affordability rule that had come out from HHS in March, but has not yet been finalized. And it also adds additional provisions that will have a significant impact on consumers, marketplaces like Access Health Connecticut, and the market itself, resulting in higher premiums. This bill really will change how and when consumers enroll, the paperwork required for them to enroll, and really critically, the premiums that they will be paying. So looking at this, the enrollment restrictions, there are several different items in the bill, shortening the open enrollment period to December 15th. So that takes a month off the open enrollment period that we've had over the last many years. Eliminating marketplace eligibility for DACA recipients, which was only recently granted for this plan year. Also eliminating eligibility for financial assistance for the premium tax credits and the cost sharing reductions for most non-citizen groups, eliminating the eligibility for financial assistance for green card holders who have not yet met the 5-year bar for Medicaid, who currently are eligible to come on the exchange and receive financial assistance when enrolling in a QHP, and eliminating eligibility for financial assistance for consumers who are not eligible for Medicaid for the work requirement. You've probably heard a lot in the news about the proposed work requirements for Medicaid that are in the bill. There is also provision that if somebody failed eligibility for Medicaid on that ground, that they would also not be eligible, excuse me, for financial assistance through an exchange. These different provisions are scheduled to take effect in the bill language at different times. Some of them are for 2026, some of them are for 2027 or 2028. You go to the next slide, Marcin. We'll look at auto renewal process limitations and verifications. You've probably heard a lot in the news that this bill is gutting auto renewal. It doesn't specifically speak and say you cannot auto renew, but it changes processes in a way that would make it virtually impossible for auto renewal, which has been vitally important for consumers keeping coverage and making it a much easier experience. We auto renew about 85% of our population currently. So the bill proposes to require pre-enrollment verification for eligibility for financial assistance, which would basically eliminate the presumptive eligibility and that 90-day period that consumers now have to receive the assistance while they're verifying it if they need to. They would be able to enroll in a plan, but couldn't have financial assistance until they verified it. This one is scheduled for 2028, by the way. It also would require minimum payments for consumers receiving tax credits right now that cover their entire premium. This isn't covered Connecticut. This is based on tax credits. So they would have to pay $5 a month of premium until they submitted information to verify their eligibility. They couldn't just auto enroll in that case. Requires pre-enrollment verification for special enrollments. This is one item that we're actually well positioned because we have been actually doing this ourselves for many, many years. So this one isn't really an issue for us or our consumers. It removes the special enrollment period for low-income consumers that has been in place for several years for consumers with income below 150% of the federal poverty level. It reduces the failure to reconcile time period from 2 years back to 1 year. It had been 1 year for most of the time, and for the last, I'd say, 2 years, the previous administration had extended it to 2 years. It requires consumer verification if IRS data is unavailable. This also was a positive change that was put in place by the Biden administration probably 2 years ago that would go away. There are instances where we aren't able to get an actual income from the IRS for various reasons. So we either get an error code or no income. We would have to go back to opening income verifications in these instances. And it would also shorten the income verification time period. Excuse me, the Biden administration had extended that just for income from 90 days to 150 days. This would take it back to the 90 days. It also proposes to make changes to QHP benefit designs, which will have a real financial impact on consumers. It increases enrollee costs with some changes that they're proposing to make to the premium adjustment percentage, which is kind of a wonky way of making costs rise for consumers. And it also proposes to relax some of the AV levels at different metal tiers, which would decrease the plan value and raise consumer costs. We are well positioned in this instance because we do only allow our standard silver plan, so we don't allow non-standard silver plans. So that's one instance where, you know, we've got a good consumer protection in place. If you go to the next one, Marcin. Thank you. These are some of the consumer financial protections that are proposed to go away. Currently, since the ACA has been in place, there have been repayment caps for APTCs for lower income consumers, protecting them against having to pay, you know, could be $8,000 or $10,000 if they had some change in their income that they maybe didn't anticipate. There were caps that kept their repayment amounts fairly low. They are proposing to take all those caps away, so any consumer, regardless of their income, would have to pay the full amount that they received that they were not entitled to. Also putting back something in place that was in place in a slightly different variation a few years back, allowing carriers to require payment of any past due premium before they effectuate a consumer's coverage in January. So if they had any consumer debt, not just from the previous plan year, any plan year to that carrier, the carrier would be able to apply the January payment back for that past debt and then require the consumer, you know, to pay the January premium separately. Also changing the premium payment thresholds that the carriers use, the amounts, you know, also making it harder on consumers. And then one that's we've talked about, and a lot of the media has talked about, prohibiting the use of APTCs for gender affirming care with the benchmark plan. And then also something that would result in reducing APTC amounts. They are proposing to properly appropriate the federal funds for the CSR payments, which the first Trump administration had stopped paying at the end of 2017 because under the argument that they were not properly allocated. But what states did to react to that was to allow silver loading to make up the difference so that the carriers were not out the premium amounts on these plans for the cost sharing reductions. They have much richer benefits for the consumers who are eligible. So this has resulted in, right now, Paul will correct me if I'm wrong, we have about an average of a 10% load on silver premiums to account for this, which winds up helping consumers across the board, both at bronze and gold, primarily because it makes APTC amounts richer. When you have higher silver premium, the APTCs go up for everyone across the board, regardless of what plan you buy. An interesting, or maybe not interesting, twist that they have in the language is also that they are proposing to prohibit these federal funds for CSR payments for plans that cover elective abortion, which our silver plans do. So this is one that I believe is being considered by the Senate parliamentarian right now. So if you go, and they are proposing this one for 2026, which really would just be a complete, you know, challenge for carriers and insurance departments, as our rates were recently submitted. Our carriers recently submitted their rates for 2026. Carriers have submitted rates across the country. So this is really late timing in the whole rate approval cycle to make such a dramatic change. You go, to the next slide, Marcin. Finally, this is the one area that the changes that they're proposing are actually positive because of, based on John's earlier presentation about our movements towards supporting ICHRA for employers. They are proposing to put the ICHRA regulations into statute. They've always been in regulations and not in statute, to codify them. And then they're also putting their own spin on it, giving it a new name called CHOICE, which stands for Custom Health Option and Individual Care Expense. So they could come up with that word choice. Two positive changes that they're proposing in the bill. One is that employees would be allowed to use their employer's cafeteria plan to have pre-tax dollars to pay premiums for an on-exchange plan. Under the current regulations, you could only do that for an off-exchange plan. So that actually is a positive for us. And also they are proposing a new tax credit for small employers, 50 FTEs and under, that use a choice arrangement for 2 years, similar time period as the small business tax credits, but a little bit different. This would be $100 per employee per month for the first year of offering ICRA, and then it drops down in half to $50 per employee per month, but a nice incentive for small employers to actually dive in and offer an ICRA. So I will pause. I know that's a lot of information. We are following this, also following, as James has been talking about, whether or not the enhanced premium tax credits will be extended. So when you factor all of this in together, this really is boding a tremendous coverage loss over the next several years for consumers in the marketplaces, along with the Medicaid losses. So really vitally important to the consumers we serve. So I'll pause.
Okay. Mr. Chair, very quickly, Susan is going to do similar, maybe a bit more in-depth presentation at the board meeting next week. So we, as Susan indicated, we know we just dropped a lot of information on this committee. So if you need time to process it, come up with questions next Wednesday rather, we're gonna have more time to ask questions. But if you have any questions now, we are ready. Susan, can you talk a little bit about all of the advocacy work that we have been doing before you close?
Sure, absolutely. As we've been talking about for quite a while, James and I have been doing a lot of advocacy work about the potential expiration of the enhanced subsidies from probably late last year into this year. And now we've really ramped up all of the work with this proposed bill and the magnitude of the changes for consumers and marketplaces. We are very active in the State Marketplace Network Group through the National Academy of State Health Policy, as we've talked about over the years. And so through our group together there, we formed kind of a really small working group, like a war room group, to kind of respond to this legislation. So there have been 2 joint letters. One was sent to the House back in May, and one was sent to the Senate. I think it was last week. We've created jointly together explainer documents on all these things, and we can forward these around, to the committee members and to the board as well. And we're sharing them with our delegations. James and I met with Senator Murphy last week and his team, and I think we're trying to also schedule something with Senator Blumenthal, as this is in the Senate right now. So just doing tremendous outreach. There was a joint virtual press conference held yesterday. So that it is a great way. Unfortunately, a lot of the attention in the press has been focused on the Medicaid changes, but I think we've really been making headway over the last couple of weeks of getting attention as well to the really strong impact on marketplace consumers as well. So a lot of work going into that.
That's great. And, I think what the members will also be interested in hearing is what elements of this is a lot. And, I think about some of the creativity that you were proposing that to engage in even a year and a half ago, to expand coverage to undercovered or in inaccessible populations, even under Access Health, even under the statutes. So I'm wondering whether you'll have at least some flavor of what, if anything, it is that we can do as a state to respond, to mitigate, or not, and where is it that our hands are tied? I don't think that our state's hands are ever really tied, other than, of course, these are very expensive propositions, and then we always, of course, have to contend with the industry. So I'm just I'm curious whether you could have some of that flavor at our next meeting. You don't have to do that now.
Sure, and I don't know if James wants to speak too. There was a bill passed by the legislature this session creating a trust fund, I think is what they refer to it as, to try to mitigate the financial impact for the state and consumers in the state for Medicaid changes and also changes to marketplaces. At the time, they were focused on the expiration of the enhanced subsidies. And then obviously, I think on our end, in addition to all the operational and system changes we'd have to make, is just really pouring our focus into the outreach aspect to do everything that we can, to your point, Steve, to really reach out to consumers, to make them, help them understand what's going on, help them through the process, and help them understand the different options that we do have available for them still.
Mr. Chairman, we know a lot of us are going to be losing Medicare if this bill becomes a law as it is currently proposed. So Tammy and her team putting together a whole strategy on to capture anyone that's losing Medicaid to come in the exchange. So that's one that, again, that's going to cost more money as we move forward. So we put together a budget, come back to the board. But we have proposed some ideas to the governor's office, to the state legislature, to come up with some funding to plug some of the gaps that this big, beautiful bill may create for Connecticut residents who currently buy insurance through the exchange. We do have those numbers that we shared with them. But more importantly, for us, it's about now our mission is to lower the uninsured in Connecticut. So we will do everything we can and we have to ensure Connecticut residents have insurance and as affordable as possible. So we'll continue to work on that. There are several proposals Susan mentioned that's been signed into law. The Access Health is part 2 study, 2 groups on the study different options that could make insurance more available to Connecticut residents going forward.
Great. Thank you. Well, we look forward to your report next week, and anything, and of course, to any questions or observations from the membership as they may develop over the next few days. Anything else, Susan, or any questions from anyone else?
I
Well,
think
thank
I'm
you
good
for that.
unless anyone has a question. No, thank you. Thanks, everyone.
Okay. Thank you. And now, Marcin, I see on the agenda that we are now up against adjournment. Is that correct?
That's correct, Mr. Chair.
Great. So if we could entertain a motion to adjourn.
Paul Lombardo moves.
Great. And a second?
It's Kathy Holt. I'll second.
Thank you, Kathy. Having properly moved and second, all in favor of adjournment?
Mr. Chair, can we?
Oh, if we could do, yes, if we could do a roll call. Thank you,
Okay.
Martin.
Thank you, Mr. Chair. Steven Hernandez,
Yes.
Ron Ritter,
Yes.
Paul Philpott, Paul Lombardo, Matthew Bratman, and Kathleen Holt.
Yes.
Thank you.
Thank you all. And with that, we are adjourned. I appreciate all of you. Thank you.
Thank you.
Thank you all.